I think we need to talk about Jeremy. First of all, Jeremy... Right. Now we've got that out of the way, let's have a look at the man behind the mayhem. So Jeremy is the Health Secretary. That makes him responsible for policy involving our healthcare arrangements in this country and the NHS. Now, Jeremy has not got the best track record with healthcare and the NHS, and before actually becoming Health Secretary, he published a book, or rather co-authored a book, in which he advocated a private health insurance scheme, where the people with money would get some choice and the people without it, well, yeah. In 2013, after becoming Health Secretary, Jeremy Hunt had a fantastic idea to start charging foreign nationals who use the NHS. Now this was where Jeremy starts getting his numbers all wrong, and he's made a bit of a habit of it since. You see, Jeremy said we'd save £200 million a year. But actually, after all the maths was done and was all kind of worked out, it turned out the figure was close to £30 million. And then of that 30 million, £23 million has already been paid by the people who received the treatment. So that left £7 million. It's not an unsubstantial amount of money. It might, might even buy Jeremy Hunt a new mansion or something to live in. But no, £7 million is actually less than it would cost to implement his little scheme. Very good. Excellent work, Jeremy. Now let's talk about junior doctors. Now, junior doctors have just voted overwhelmingly to go on strike for 3 days in December this year. Now that's almost unprecedented, and it must be something quite serious for them to consider such action. And it is. You see, doctors, like teachers and nurses and firefighters and policemen, they are pillars of our communities and our society in general. Yet we constantly hear them undermined by our government. You see, Jeremy's playing tricks again. Jeremy's saying he's giving junior doctors an 11% pay rise, but actually he's taking away their overtime, making them work longer and at more unsociable hours for no benefit. That doesn't sound fair to me. The worst thing about this is that he is disincentivising junior doctors from working in the NHS and in this country in general. That means that soon enough we're going to have a shortage of doctors and medical professionals in this country. And then where will we go? Because once they're out of the country, it doesn't matter if you've got Bupa or BMI healthcare or what. There's no doctors. And then what do? Then you end up with one of these funny situations where instead of people coming here to use our healthcare, we're going to have to actually go to other places. We're going to have to go to Australia to use their healthcare system, because that's where a lot of our doctors are going. And I can't blame them. They're being persecuted by their government and they feel unsupported. Now, could this all be part of a big plan to make the public lose faith in the NHS? After all, at the moment, we all support the NHS. We're all behind the NHS. And if the government tried to do anything too drastic or overt, we'd shut them down. But what if they can persuade us that the NHS isn't right? It's not good. It doesn't work. Then perhaps they might be able to change things. But what I see here is a government actually making the NHS worse. And making the NHS worse so that they can implement their privatisation policies. That doesn't sound right to me, and if it doesn't sound right to you, share this video, make sure everybody knows what Jeremy is all about. Thanks for watching, and don't forget to subscribe below. Thanks very much.